Hi, my name is Heidi Keeling, and I'm a speech and language therapist who is working for adults with intellectual and developmental disabilities services in Nottinghamshire. And I'm here with my colleagues. We got Maria. Would you be okay to introduce yourself?
Yeah, hi. I'm the clinical lead dietitian for the intellectual disabilities.
Thank you, Maria. And then we got Stuart.
Yes, I'm Stuart. I'm the physio clinical lead for adult intellectual disabilities.
And Rob.
Hi, I'm Rob Wilson, OT professional lead for IDD, Intellectual and Developmental Disabilities team.
Yeah, so we work with adults with intellectual disabilities or autism with intellectual disabilities in Nottinghamshire as a community service for the NHS. And what we are going to talk about is some of the work we do specifically to our professions and how we sort of work together to achieve the best outcomes for the people we support and we work with. So Maria, are you okay to describe the work you would do with this population we support?
Yes, certainly. So our service is for adults who have intellectual disabilities and complex physical, medical, social or behavioural issues and the people needing specialist or intensive dietetic input. Just a couple of examples of the type of work that we do is tube feeding advice for people with dysphagia to enhance quality of life, and advice on diet and supplements for people who are malnourished or significantly underweight.
Okay, thank you. And Stuart, are your turn?
Yeah. So we provide specialist physiotherapy support for adults with intellectual disabilities who are unable to or find it difficult to engage with mainstream services. We kind of provide all the usual kind of physiotherapy skills that you would expect in mainstream. So, we look at range of movement, muscle strength, balance coordination, gross motor, fine motor function skills. We also support people with mobility difficulties who may have fallen or may be at risk of falls. And we do a lot of work around postural care for individuals who aren't able to maintain or sustain their posture. So using specialist equipment, so specialist seating, sleep systems, standing frames, all that kind of thing. But we also do offer support for individuals who are able to access mainstream services, but might need additional support just to make that contact more positive and more meaningful for them.
Okay, thank you. And Rob.
Hiya, yeah. So the IDD Occupational Therapy team work with people to overcome any barriers that are impacting their participation in meaningful or purposeful occupation, which is specifically in place because of the impact of their intellectual disability. So this can be helped with supported with daily living tasks, also support with kind of sensory assessments. The team are kind of trust leaders in specialist sensory assessment and understanding, challenging behaviour in relation to PBS support, a lot around kind of dementia referrals and supporting clients to kind of age well and to get the best out of quality of life, roles and routines, and other areas such as mealtime assessments. So a very holistic approach to looking at creating a kind of fair dynamic within societies and making sure that our service users' needs are well met and looked after.
Okay, and from a speech and language therapy perspective, I can say that we mirror and match you in so many ways. We're working with the same type of people, and our focus is on enabling people to have good communication and positive relationships with people. So we work with the individuals and their carers on enabling communication. We also support people to have healthy and safe eating and meal times as well. So just from listening to all of us, there's so many overlaps. So in some ways, that brings us on to the next bit where we talk about what we appreciate about working together. So I don't know who wants to go first.
I certainly find that with working as a team and with the wider MDT, it's so beneficial in achieving good outcomes for our patients.
Yeah,
Absolutely. I mean, we're all function based. I mean, we're all working on individuals, functional ability and their ability to kind of engage with and do things that they want to be achieving and want to do. And I think we're all part of that big machine that actually achieves that. And without each individual, profession, I don't think that's achievable, because when you think about functional tasks, I mean, they involve every aspect of the AHP work that we all do.
Yeah, exactly. Yeah. Rob, do you want to add anything?
Yeah, I was just going to add that obviously we really value working with our medical and nursing colleagues as in terms of getting meds optimization and reducing medication where needed. But sometimes kind of in Western society, I guess we tend to place a high value on that kind of medical approach. And when that reaches its kind of optimum levels, I think that's where really the therapy model complements that, and actually our services, AHPs, allied health professionals in IDD, really show our strength, because the impact on a person with an ID's life is sometimes a lot greater when you think about the therapy input and looking at the kind of holistic approach, working together and looking to kind of increase quality of life beyond just medication and just kind of nursing care. So yeah, I was certainly very proud of being an AHP in IDD and such a specialist service, and glad to work with AHP colleagues.
Thank you. And that really brings us on to talk about what our aspirations are for the future as well. I think the conversations we had previously is in relation to coming out of COVID, having had to work very differently. How can we make improvements that is also improvements for our service users? And there are quite a lot of projects we got in the pipeline around looking at the care pathways and looking at how people are able to transition into our service better. So we are developing a single point of access that should help with that. We also we're looking at transitions into services from children's services into adult services as well as starting to do some face-to-face therapy a bit more. So we're doing more therapeutic groups and things like that. Is there anything you would like to add?
I guess from my perspective, I think what the directorate understood and listened to were very key in focusing on service user involvement and feedback, and understanding that our service users' interpretation of the services we offer in order to kind of improve the quality of our teams and our service. And what COVID kind of showed us was that potentially the routes into our referral routes into different professions weren't as slick and as kind of well managed as they could be. I think we're really proud of our current single point of access that we launched within the midst of COVID, and that's created some, like Heidi says, some really exciting work around pathways through, and also kind of intervention pathways for AHPs as well as other professions. It's increased communication between different professions and understanding and access, which has been brilliant, because now we're sitting in kind of regular MDT meetings to screen referrals. There's a greater understanding of what we each do and how we complement each other, and that's been a real thing to celebrate, I think, based on, it's come from something quite negative in COVID, but actually it's a real positive, and it's a real service improvement that we're really proud of in IDD services.
Yes, and I can only add that the positivity of this, and what we sort of aspire to do, is that we will reduce the amount of time that people need for more specialist services, and in terms of their mental health and the impact their sort of daily living and some of the problems they may experience, and how it impacts on their mental health. And we would like to reduce that, and that's the sort of longer term aspiration for us as professionals and allied health professionals into IDD services. Okay, so any final thoughts before we finish? Thank you so much, Maria and Stuart and Rob, for taking part in this recording, and I hope you all have a good Allied Health Professional Day on the 14th of October. Thank you.
Thank you.
Thank you.
Good.